Welcome to channel. In this video we will talk about China. The first confirmed case of COVID-19 has been traced back to the 1st of December 2019 in Wuhan. One unconfirmed report suggests the earliest case was on the 17th of November. Dr. Zhang Jixian observed a pneumonia cluster of unknown cause on the 26th of December, upon which her hospital informed Wuhan Jiangnan CDC on the 27th of December. A public notice was released by Wuhan Municipal Health Commission on the 31st of December. The WHO was informed on the same day. As these notifications occurred, doctors in Wuhan were warned by police for spreading rumor about the outbreak. The Chinese National Health Commission initially claimed that there was no clear evidence of human-to-human transmission. The Chinese government launched a radical campaign later described by the Chinese Communist Party General Secretary Xi Jinping as a people's war to contain the spread of the virus. In what has been described as the largest quarantine in human history, a cordon sanitaire was announced on the 23rd of January, stopping travel in and out of Wuhan, which was extended to a total of 15 cities and Hubei, affecting a total of about 57 million people. Private vehicle use was banned in the city. Chinese New Year, the 25th of January celebrations were cancelled in many places. The authorities also announced the construction of a temporary hospital, Huashanshan Hospital, which was completed in 10 days, and 14 temporary hospitals were constructed in China in total. Another hospital was built afterwards, Liangshan Hospital, for quarantine patients. On the 26th of January, the government instituted further measures to contain the COVID-19 outbreak, including issuing health declarations for travelers and extending the Spring Festival holiday. Universities and schools around the country were also closed. The regions of Hong Kong and Macau instituted several measures, particularly in regard to schools and universities. Remote working measures were instituted in several Chinese regions. Travel restrictions were enacted in and outside of Hubei. Public transport was modified and museums throughout China were temporarily closed. Control of public movement was applied in many cities, and it has been estimated that about 760 million people, more than half the population, faced some form of outdoor restriction. On the 23rd of March, mainland China, only one case had transmitted domestically in the 5 days prior, in this instance via a traveler returning to Guangzhou from Istanbul. On the 24th of March 2020, Chinese Premier Li Keqiang reported that the spread of domestically transmitted cases has been basically blocked and the outbreak has been controlled in China. The same day travel restrictions were eased in Hubei, apart from Wuhan, 2 months after the lockdown was imposed. The Chinese Ministry of Foreign Affairs announced on the 26th of March 2020 that entry for visa or residence permit holders would be suspended from 28 March onwards, with no specific details on when this policy will end. Those who wish to enter China will have to apply for visas in Chinese embassies or consulates. The Chinese government encouraged businesses and factories to reopen on the 30th of March, and provided monetary stimulus packages for firms. The State Council declared a day of mourning to begin with a national 3-minute moment of silence on 10 o'clock the 4th of April, coinciding with Qingming Festival, although the central government asked families to pay their respects online in observance of physical distancing as to avoid a renewed COVID-19 outbreak. In this video we have discussed about China, and now we will discuss about South Korea. COVID-19 was confirmed to have spread to South Korea on the 20th of January 2020 from China. The nation's health agency reported a significant increase in confirmed cases on the 20th of February, largely attributed to a gathering in Daegu of a new religious movement known as the Shinkuanji Church of Jesus. Shinkuanji devotees visiting Daegu from Wuhan were suspected to be the origin of the outbreak. 545 as of the 22nd of February, among 9,336 followers of the Church. 1,261 or about 13% reported symptoms. South Korea declared the highest level of alert on the 23rd of February 2020. On the 28th of February, more than 2,000 confirmed cases were reported in Korea, rising to 3,150 on the 29th of February. All South Korean military bases were quarantined after tests confirmed that 3 soldiers were positive for the virus. Airline schedules were also affected and therefore they were changed. South Korea introduced what was considered the largest and best organized program in the world to screen the population for the virus, and isolate any infected people as well as tracing and quarantining those who contacted them. Screening methods included mandatory self-reporting of symptoms by new international arrivals through mobile application, drive-through testing for the virus with the results available the next day, and increasing testing capability to allow up to 20,000 people to be tested every day. South Korea's program is considered to be a success in controlling the outbreak despite not quarantining entire impeachment of Moon over what they claimed to be government mishandling of the outbreak, or praising his response. On the 23rd of March, it was reported that South Korea had the lowest one-day case total in 4 weeks. On the 29th of March it was reported that beginning the 1st of April all new overseas arrivals will be quarantined for 2 weeks. Per media reports, on the 1st of April, South Korea has received requests for virus testing assistance from 121 different countries. In this video we will talk about China, South Korea. In next videos we will talk about other countries.
Press the bell icon on the YouTube app and never miss another update.